Hey there, Toby Stark, Stark Associates Insurance Agency. I just wanted to go over for you Medicare beneficiaries. What's going on? What are you doing during the election period that we have now, the annual election period, which is October 15th to December 7th? Why are we looking at our drug plans and why are we moving them around? Well, this is the true out-of-pocket cost of Medicare Part D. We want to thank the National Association of Health Underwriters for putting this graphic together. This is easier to understand. A lot of people don't have any type of clue. When do I hit the deductible for Part D, which is the drug plan? What is my deductible? Well, last year, most plans had a deductible of $445. It's actually going up to $480 for 2022 here. So what you need to keep in mind is most of you have lower cost generic maintenance medications, which means a lot of that cost of the drug is going to be included in the plan's premium that you're enrolling in anyway. So I get a lot of questions where the ask is, well, when do I hit my deductible? And I say, well, based upon your maintenance medications and how low cost they are, it could be $1 or $2. You'll never actually hit your deductible for the year. And most of you that I'm talking to may not. There are some of you out there that are going to step along in the phases because you might be using some type of brand name drug or some injectable that's extremely expensive. So you are going to go through the path which starts from the deductible stage and ends at catastrophic coverage here. And I'm just going to quickly walk you through this so you have an idea of how it works. And again, I'm just using topical examples. It's hard to really dial down on what the true amount of the insurance carrier is going to share the cost with you. But I wanted to let you know that you are going to be working together with the insurance carrier, and that's called your true out-of-pocket cost, which is the insurance carrier is paying and you're paying too. What do I mean by that? So you're going to enter first the deductible stage where you are responsible for 100% of your prescription drug costs until the deductible is met. Again, a lot of you out there, Medicare beneficiaries, will not be leaving this stage because you have generic maintenance medications. But, and I know that I've spoken to you before, health is fluid and changing every day. You may not be on something now, but in a year from now, you might be on a maintenance medication due to your health that's of higher cost. So an educated consumer is an empowered consumer, and we're trying to help you do that. So let's say that you meet your deductible here and you hit your $480. What that means is now the insurance carrier is active and is going to be sharing the cost with you during the initial coverage phase. You pay a copay or coinsurance. So copay is just a flat dollar amount, $10, $20, $30, or coinsurance, that's a percentage where you're sharing the cost with the insurance carrier. Your Part D plan pays the rest for prescription drugs included on your plan's formulary or list of covered medications. So that's the initial coverage, okay? And then you will enter what's called the coverage gap. Read this carefully. After you end your plan, you and your plan have together spent $4,430 on prescription drugs, then you enter the coverage gap. This is what everybody talks about was the donut hole. What about the donut hole? What about, well, it's changed. It's called the coverage gap. Now you, the consumer, pay 25% of the cost for both generic and brand name drugs, plus a small pharmacy dispensing fee of about $1 to $3. As you could see in the infographic, you're stepping up from the deductible stage, initial coverage, and then the highest stage is the coverage gap, and you're kind of leaping off into a lower stage of catastrophic coverage. You want to spend, not that you can help it, but as little as time as possible in the coverage gap because your maintenance medication costs are going to be the highest. So nobody wants to hang out in the coverage gap, and few of you will ever get there. And those of you that do and leave the coverage gap are going to get to what's called catastrophic coverage. After your total out-of-pocket expenses on prescription drugs, plus any discounts you received on brand name drugs while in the coverage gap, reach $7,050, then you pay a small copay or coinsurance through the end of the year. So a lot of folks, if they wind up in catastrophic coverage here, there's been a combination of monies laid out to get them to the $7,050, and this is for 2022 here. So what that means is that's not the end of it. A lot of people think if you hit that, it's a maximum out of pocket. It is not. You'll still have to pay a small copay or sharing of costs through the end of the year for your drugs. Once you get used to that low cost, unfortunately, you go, this is great. I went through all the stages. Then guess what happens? Comfort enters, and then the plan year starts all over again in January. No matter what, everything resets January 1st, and you return to the deductible stage at the beginning of the year. So for some folks, just because they don't understand the steps, it gets frustrating because in January, if they have a higher cost maintenance med and they were, say, paying $5 to $7 because they were in the catastrophic coverage area, then all of a sudden they have to pay $480 for that drug. And then they go, what happened? Well, what happened is the drug plan year restarted. Toby Stark, Stark Associates, reach out to us, email us, toby@stark-associates.com. Happy to help. Happy annual election period. For you folks out there that are Medicare beneficiaries, I'll say it many times, take a look at your maintenance meds. 7 out of 10 Medicare beneficiaries do not do any research to change their drug plan and just simply stay as is. You need to be proactive. Us as an individual broker are happy to help you do that. We're here to educate so you can make a great decision and set yourself up for the next year. Thanks again.